Kinesiology MBLEx Exam Question and Answer. Question 1. What is the movement in which the thumb meets the ring finger? A. Thumb adduction. B. Thumb abduction. C. Thumb flexion. D. Thumb opposition. The right answer is thumb opposition. Explanation. The opposable action of the thumb is a unique movement that allows a connection between the thumb and the remaining 4 digits. This action creates our ability to grip objects. Question 2. The knee is an example of a joint. A. Pivotal hinge. B. Saddle. C. Condyloid. D. Triaxial. The right answer is pivotal hinge. Explanation. The movements of the knee earns the classification of a pivotal hinge joint, which allows for flexion and extension, as well as slight medial and lateral rotations. The knee is also the largest joint in the human body. Question 3. Massage movement towards the heart is characterized as A. Centrifugal. B. Centripetal. C. Interior. D. Distal. The right answer is centripetal. Question 4. Which of the following describes the joint classification of the glenohumeral joint? A. Cartilaginous. B. Diarthrosis. C. Amphiarthrosis. D. Synathrosis. The right answer is Diarthrosis. Explanation. The glenohumeral joint, also known as the shoulder joint, is classified as a diarthrosis joint. This joint classification describes joints that are freely movable like the knee, hip, ankle and wrist. Question 5. The nutrients needed in the Haversian system are supplied by blood vessels found in A. Periosteum. B. Big bone. C. Cartilage. D. Joints. The right answer is periosteum. Explanation. The periosteum is the fibrous membrane of connective tissue that snugly covers all bones, but it does not cover articular surfaces, where bones come in contact with each other. The periosteum also contains attachment sites for muscles, ligaments, and tendons. For adults, the periosteum is responsible for forming new bone as a result of injury or infection. Question 6. Placing weight on the inner edge of the foot is an example of A. Inversion. B. Pronation. C. Eversion. D. Flexion. The right answer is eversion. Explanation. Turning the sole of the foot outward by placing weight on the inner edge of the foot is eversion. Question 7. Is elevation of medial edge of the foot so that the sole is turned inward, or medially. A. Inversion. B. Eversion. C. Dorsiflexion. D. Plantar flexion. The right answer is inversion. Question 8. Flexing the ankle dorsally so that the toes are moving toward the shin? A. Plantar flexion. B. Dorsiflexion. C. Rotation. D. Supination. The right answer is dorsiflexion. Explanation. Dorsiflexion where the toes are brought closer to the shin. This decreases the angle between the dorsum of the foot and the leg. For example, when walking on the heels the ankle is described as dorsiflexion. Question 9. Is the movement which decreases the angle between the sole of the foot and the back of the leg. For example, when depressing an car pedal or standing on the tiptoes can be described as plantar flexion. A. Protraction. B. Plantar flexion. C. Dorsiflexion. D. Rotation. The right answer is plantar flexion. Explanation. Plantar flexion is extension of the ankle so that the toes are pointing downward. Question 10. Moving the left hand from in front of the right hip to the front of the left shoulder is an example of A. diagonal adduction. B. External rotation. C. Diagonal abduction. D. Horizontal abduction. The right answer is diagonal abduction. Explanation: the movement in question indicates a diagonal abduction, and returning the hand to the starting point would be a diagonal adduction. Question 11. The up phase of a wide arm push-up creates which type of contraction of the tricep muscle? A. Isometric. B. Eccentric. C. Auxotonic. D. Concentric. The right answer is concentric. Explanation: a concentric contraction is one where the muscle shortens under force. Question 12. The proximal articulation of the radius is an example of a underscore joint. A. Pivot. B. Condyloid. C. Ball and socket. D. Saddle. The right answer is pivot. Explanation: the back and forth, uniaxial rotation of the proximal radial articulation is classified as a pivot joint. This is the action of pronation and supination of the forearm. Question 13. The symphysis pubis is a underscore joint? A. Amphiarthrotic. B. Diarthrotic. C. Fibrous. D. Synathrotic. The right answer is amphiarthrotic. Explanation: amphiarthrosis is a type of continuous, slightly movable joint. Question 14. Reciprocal motion refers to underscore? A. Alternating motions in the same directions. B. Alternating motions in opposing directions. C. The well-being of the client. D. Movement that involves grasping of the thumb and fingers. The right answer is alternating motions in opposing directions. Explanation: reciprocating motion, also called reciprocation, is a repetitive up and down or back and forth linear motion. It is found in a wide range of mechanisms, including reciprocating engines and pumps. The two opposite motions that comprise a single reciprocation cycle are called strokes. Question 15. With a client and number 8217's arm at their side in a 90-degree angle and the palm facing up, what is the movement of the forearm that rotates the palm to face downward? A. Pronation. B. Supination. C. Downward rotation. D. Circumduction. The right answer is pronation. Explanation: pronation is the action of the pronator teres muscle located along the flexors of the forearm which rotates the palm to face downward. To rotate the hand from a downward-facing position to an upward would be the action of supination. Question 16. The only saddle joint of the body is found in the underscore? A. Wrist. B. Thumb. C. Hand. D. Mandible. The right answer is thumb. Explanation: a saddle joint is more versatile than either a hinge joint or a gliding joint. It allows movement in two directions. The saddle joint gives the human thumb the ability to cross over the palm of the hand. Question 17. Underscore of the forearm occurs when the forearm or palm are rotated outwards. A. Rotation. B. Dorsiflexion. C. Supination. D. Pronation. The right answer is supination. Question 18. The knee and elbow are an example of an underscore joint? A. Hinge. B. Pivot. C. Gliding. D. Pivot. The right answer is hinge. Explanation: a hinge joint is a common class of synovial joint that includes the ankle, elbow, and knee joints. Hinge joints are formed between two or more bones where the bones can only move along one axis to flex or extend. Question 19. Another name for amphiarthrosis is underscore? A. Fibrous joint. B. Synovial joint. C. Cartilage joint. D. Diarthrotic joint. The right answer is cartilage joint. Question 20. Which muscle is a synergist to lateral rotation of the hip? A. Pectineus. B. Gemellus inferior. C. Adductor magnus. D. Tensor fasciolati. The right answer is gemellus inferior. Explanation: gemellus inferior, one of the 7 deep lateral rotators of the hip, is a synergist of lateral rotation of the hip. Question 21. Which muscle is a synergist to mandible elevation? A. Pectineus. B. digastric. C. mylohyoid. D. pterygoid. The right answer is pterygoid. Explanation: both the medial and lateral pterygoid muscle assists the masseter and temporalis muscles with mandible elevation. Question 22. The axial skeleton contains the following bones? A. vertebrae, sacrum, ilium, cranium. B. vertebrae, clavicle, ribs, skull. C. rib, sternum, vertebrae, ossicles. D. rib, sternum, skull, clavicle. The right answer is rib, sternum, vertebrae, ossicles. Explanation: the axial skeleton is the portion of the human skeleton that consists of the bones of the head and trunk of an organism. In humans, it consists of 80 bones and is composed of 8 parts: the skull bones, the ossicles of the middle ear, the hyoid bone, the rib cage, sternum and the vertebral column. Question 23. What type of joint is the first carpal metacarpal joint? A. hinge. B. saddle. C. gliding. D. pivot. The right answer is saddle. Explanation: the first carpal metacarpal joint is located in the thumb. The dynamic movements of the thumb is due to the saddle joint, which allows for an up and down as well as back and forth motions. Question 24. Which condition would directly contribute to anterior pelvic tilt? A. hypertonic hamstrings. B. hypotonic quads. C. hypotonic abdominals. D. hypotonic low back muscles. The right answer is hypotonic abdominals. Explanation: hypotonic abdominals, as these muscles would allow the pelvis to drop and rotate forward, which is an anterior pelvic tilt. Question 25. Joint with the greatest range of movement? A. ellipsoidal. B. saddle. C. pivot. D. ball and socket. The right answer is ball and socket. Explanation: the ball and socket joint, or spheroidal joint, is a joint in which the ball-shaped surface of one rounded bone fits into the cup-like depression of another bone. The distal bone is capable of motion around an indefinite number of axes, which have one common center. It enables the bone to move in many planes, almost all directions. Question 26. The structure by which bone connects to another bone is a underscore? A. ligament. B. muscle. C. tendon. D. cartilage. The right answer is ligament. Explanation: a ligament is the fibrous tissue that connects bones to other bones and is also known as articular ligament. Question 27. Underscore is a tough band of fibrous connective tissue that usually connects muscle to bone and is capable of withstanding tension. A. muscle. B. tendon. C. ligament. D. cartilage. The right answer is tendon. Question 28. The hip joint is also known as a underscore joint. A. multiaxial. B. biaxial. C. uniaxial. D. Amphiarthrosis. The right answer is multiaxial. Explanation: the hip joint is a ball and socket type joint that allows for multiple movements. This is referred to as a multiaxial joint. Question 29. What type of joint is the talocrural joint? A. Gliding. B. Ball and socket. C. Hinge. D. Saddle. The right answer is hinge. Explanation: the talocrural joint is a synovial hinge joint that allows for plantar flexion and dorsiflexion. Question 30. Which muscle is a synergist to medial rotation of the hip? A. Tensor fasciolati. B. Iliacus. C. Biceps femoris. D. sartorius. The right answer is tensor fasciolati. Explanation: the tensor fasciolati or TFL contributes to medial or internal rotation of the hip along with the gluteus medius and minimus. Question 31. Teres minor is an antagonist of the underscore? A. Tricep. B. Subscapularis. C. Bicep. D. Latissimus dorsi. The right answer is subscapularis. Explanation: antagonists are muscles that counter or do the opposite action of an agonist or paired muscle. Question 32. Which of the following muscles is known as a pinnate muscle? A. External obliques. B. Rectus femoris. C. Psoas major. D. Pectoralis major. The right answer is rectus femoris. Explanation: there are 5 different muscle classifications within the human body. This includes circular, convergent, parallel, fusiform and pinnate muscles. The rectus femoris is a pinnate muscle and more specifically a bipinnate muscle. This means it has 2 rows of muscle fibers that face in opposite diagonal directions in relation to the tendon. This fiber design creates an incredibly powerful muscle but has the drawback of limited range of motion. Question 33. Scalene muscles are underscore? A. Extensors of the neck. B. Lateral rotators of the hip. C. Flexors of the forearm. D. An accessory to inhalation. The right answer is an accessory to inhalation. Explanation: scalene muscles, along with the sternocleidomastoid, are accessory muscles to inhalation, in that they assist with breathing. Scalene muscles originate along the transverse processes of vertebrae C2 through C7 and insert into the first and second ribs. They are also known as the lateral vertebral muscles since they laterally flex the head to the same side as well as elevate the first and second ribs during inhalation. Question 34. Holding weight in a fixed position with no movement is an example of underscore contraction. A. An eccentric. B. An isotonic. C. An isometric. D. A concentric. The right answer is an isometric. Explanation: an isometric contraction is one where muscle length is constant or unchanging under force. Question 35. Underscore of the scapula brings the medial border of the scapula closer to the spine. A. Elevation. B. Depression. C. Protraction. D. Rotation. The right answer is protraction. Explanation: protraction of the scapula expands the space between the spine and the medial border of the scapula. The action for bringing the scapula closer to the spine is retraction. Question 36. Hinge and pivot joints are examples of underscore joints. A. Triaxial. B. Biaxial. C. Multiaxial. D. Uniaxial. The right answer is uniaxial. Explanation: uniaxial joints allow for movement along only one plane of the body around a single axis, which explains the function of both hinge and pivot joints. Question 37. An inferior movement of the scapula is known as scapular underscore. A. Elevation. B. Depression. C. Rotation. D. Adduction. The right answer is depression. Explanation: depression of the scapula refers to an inferior movement. An example would be to return the scapula to a normal position after a shoulder shrug. Question 38. What is the name of the movement that allows a person to stand on their toes? A. Dorsiflexion. B. Plantar flexion. C. Inversion. D. Haversian. The right answer is plantar flexion. Explanation: plantar flexion is the movement that increases the angle between the shin and the superior surface of the foot, which allows a person to stand on their toes. Question 39, where the toes are brought closer to the shin. This flexion decreases the angle between the dorsum of the foot and the leg. An example includes the position of the foot when walking on the heels. A. Plantar flexion. B. Dorsiflexion. C. Inversion. D. Haversian. The right answer is dorsiflexion. Question 40. Which of the following structures support the body while in the sitting position? A. Ischial-tuberosity. B. Coccyx. C. Sacrum. D. Femur. The right answer is ischial-tuberosity. Explanation: ischial-tuberosity is a large swelling posteriorly on the superior ramus of the ischium. It marks the lateral boundary of the pelvic outlet. When sitting, the weight is frequently placed upon the ischial-tuberosity. The gluteus maximus covers it in the upright posture, but leaves it free in the seated position. Question 41. Which muscle is an agonist to flexion of the hip? A. Gluteus medius. B. Pectinis. C. Gracilis. D. Biceps femoris. The right answer is pectinis. Explanation: the pectinis muscle, proximally located at the anteromedial portion of the femur, is an adductor and medial rotator of the hip in addition to its main function of hip flexion. Question 42. Where is the origin of the rectus femoris? A. Cis. B. Ais. C. Acis. D. Tibial tuberosity. The right answer is Ais. Explanation: the rectus femoris is a bipinnate muscle, which means it has two separate origins. The straight head and largest of the two origins is located at the anterior inferior iliac spine or Ais. The second origin, known as the reflected head, connects to the ilium above the acetabulum. The insertion is onto the tibial tuberosity via the patellar tendon. Question 43. The correct action of the latissimus dorsi muscle? A. Abducts, extends and externally rotates the arm at the shoulder. B. Abducts, extends and internally rotates the arm at the shoulder. C. Adducts, extends and externally rotates the arm at the shoulder. D. Adducts, extends and internally rotates the arm at the shoulder. The right answer is adducts, extends and internally rotates the arm at the shoulder. Explanation: the latissimus dorsi muscle originates along the spinous processes of T7 to L5, iliac crest, inferior third and or fourth ribs, inferior angle of the scapula and the thoracolumbar fascia. The insertion is into the bicipital groove, intertubercular groove, of the humerus between the teres major located medially and the pectoralis major located laterally. This insertion point between the two major muscles has earned the latissimus dorsi the moniker, the lady between two majors. The action of the latissimus dorsi is to internally, medially, rotate the arm, adduct the arm and then extend the arm. Question 44. Which of the following muscles is a hip abductor? A. Pectinis. B. Bicep femoris. C. Gracilis. D. Sartorius. The right answer is Sartorius. Explanation: hip abduction is produced by four muscles, the gluteus medius, gluteus minimus, tensor fasciolati and sartorius. Question 45. Condyloid and saddle joints are examples of joints. A. Multiaxial. B. Biaxial. C. Uniaxial. D. Triaxial. The right answer is biaxial. Explanation: Condyloid and saddle joints allow for movement in two different planes along two axes of the body. This is known as a biaxial joint. Question 46. The up phase of a wide arm push-up creates which type of contraction of the bicep muscle? A. Eccentric. B. Concentric. C. Auxotonic. D. Isometric. The right answer is eccentric. Explanation: an eccentric contraction is one where the muscle lengthens under force. Question 47. Which of the following muscles are synergists to the gluteals? A. Psoas and iliacus. B. Hamstrings and piriformis. C. Rectus femoris and psoas. D. Sartorius and vastus lateralis. The right answer is hamstrings and piriformis. Explanation: synergists are muscles that assist the action of the agonist, or primary functioning muscle. In this case, the synergists to the gluteals are the hamstrings and piriformis. Question 48. Which of the following muscles adduct the hip? A. Longissimus. B. Quadriceps. C. Pectinis. D. Tensor fasciolati. The right answer is pectinis. Explanation: there are 5 hip adductors that include the adductors longus, brevis and magnus, as well as the gracilis, and the correct answer for the question, the pectinis. Question 49. Which muscle is responsible for depression of the ribs? A. Quadratus lumborum. B. Quadriceps. C. Pelvic tilt. D. Intercostal. The right answer is intercostal. Explanation: the intercostal muscles located between each rib are mainly involved with breathing by either elevating the ribs during inspiration or depressing the ribs during expiration. Question 50. Ulnar flexion is also known as wrist _ A. Abduction. B. Pronation. C. Adduction. D. Supination. The right answer is adduction. Explanation: in the anatomically correct position, ulnar flexion or deviation is the action of moving the wrist into adduction. Question 51. Which of the following joint classifications would be described as slightly movable? A. Synathrosis. B. Diarthrosis. C. Amphiarthrosis. D. Synovial. The right answer is Amphiarthrosis. Explanation: a slightly movable joint is classified as an Amphiarthrosis joint. Question 52. Which muscle group is responsible for leg extension? A. Anterior compartment. B. Gluteals. C. Hamstrings. D. Quadriceps. The right answer is quadriceps. Explanation: the quadriceps insert onto the tibial tuberosity via the patellar tendon and, as a group, act as a powerful extensor of the leg. The quadriceps consist of 4 muscles: vastus lateralis, vastus medialis, vastus intermedius and the rectus femoris. Question 53. Piriformis, gemally superior and obturator internus are part of the _ group. A. Lateral rotator. B. Extensor. C. Adductor. D. Extensor. The right answer is lateral rotator. Explanation: piriformis, gemally superior and obturator internus along with the gemally inferior, obturator externus and the quadratus femoris all make up the lateral rotator group of the hip. An easy way to remember the order is PGAG. Question 54. The sternocleidomastoid action of flexion of the neck is an example of _ contraction. A. A concentric. B. An eccentric. C. An isometric. D. An auxotonic. The right answer is a concentric. Explanation: a concentric contraction is one where the muscle shortens under force. Flexion of the neck is the concentric contraction and natural action of the sternocleidomastoid. Question 55. Exercise during which the patient does not assist the therapist is called A. Passive. B. Coordinate. C. Active. D. Resistive. The right answer is passive. Explanation: passive range of motion exercises help keep a person and number 8217s joints flexible, even if he cannot move by himself. Range of motion is how far the person and number 8217s joints can be moved in different directions. The exercises help you move all the person and number 8217s joints through their full range of motion. Question 56. Which would you use to increase mobility at a joint? A. Passive. B. Range of motion. C. Friction. D. Massage. The right answer is range of motion. Explanation: as used in the biomedical and weightlifting communities, range of motion refers to the distance and direction a joint can move between the flexed position and the extended position. The act of attempting to increase this distance through therapeutic exercises, range of motion therapy, stretching from flexion to extension for physiological gain, is also sometimes called range of motion. Question 57. Function of ligaments is to A. Connect muscles to muscles. B. Connect muscles to bone. C. Stabilize the joint. D. Move a joint. The right answer is stabilize the joint. Explanation: ligaments are in every joint in the body. That means that wherever two bones meet, ligaments are there to connect them. The elasticity of the fibrous ligaments allows them to change shape and lengthen under stress and then return to their original shapes. There are several distinct functions of ligaments in the human body. 1. Define range of motion. 2. Protect joints and bones. 3. Protect joints and bones. Question 58. If you ask a client to turn his head to the side so you can see how much range of motion he has, this is considered what type of movement? A. Active resisted. B. Resistive. C. Passive. D. Active. The right answer is active. Explanation: active range of motion, or ARM, and number 8211, patient performs the exercise to move the joint without any assistance to the muscles surrounding the joint. Question 59. The carpal-metacarpal joint of the thumb is which type of joint? A. Ball and socket. B. Ellipsoidal. C. Saddle. D. Synsmosis. The right answer is saddle. Explanation: the carpal-metacarpal (CMC) of the thumb is a saddle joint that permits a wide range of motion and is largely responsible for the characteristic dexterity of human prehension. This joint, located at the very base of the thumb, is subject to large physical stresses throughout life. Question 60. Axial skeleton contains these bones? A. Rib, sternum, hyoid, clavicle. B. Cranium, facial, sternum, vertebrae. C. Vertebrae, pelvic, skull, ribs. D. Ossicles, skull, scapula, vertebrae. The right answer is cranium, facial, sternum, vertebrae. Question 61. The anterior process on the scapular? A. Olecranon. B. Coracoid. C. Xiphoid. D. Acromion. The right answer is coracoid. Explanation: the coracoid process is a small hook-like structure on the lateral edge of the superior anterior portion of the scapula. Pointing laterally forward, it, together with the acromion, serves to stabilize the shoulder joint. It is palpable in the delta pectoral groove between the deltoid and pectoralis major muscles. Question 62. The sternum from superior to inferior? A. Breastbone, body, xiphoid. B. Body, xiphoid, manubrium. C. None of these. D. Manubrium, body, xiphoid. The right answer is manubrium, body, xiphoid. Explanation: sternum consists of three main parts, listed superior to inferior: manubrium, body of sternum; gladiolus, xiphoid process. Question 63. What connects muscle to bone? A. Ligaments. B. Tendons. C. All of these. D. Cartilage. The right answer is tendons. Explanation: a tendon, or sinew, is a tough band of fibrous connective tissue that usually connects muscle to bone and is capable of withstanding tension. Tendons are similar to ligaments and fasciae. All three are made of collagen. Ligaments join one bone to another bone, fasciae connect muscles to other muscles. Tendons and muscles work together to move bones. Question 64. Example of hinge joint? A. Interphalangeal. B. Knee. C. Elbow. D. All of these. The right answer is all of these. Question 65. An individual and number 8217:s range of motion is the best determined through A. Palpation of the joint. B. An assessment of joint movement. C. Using PNF techniques. D. Any form of stretching. The right answer is an assessment of joint movement. Question 66. The shoulder joint is an example of a _ A. Ball and socket joint. B. Hinge joint. C. Pivot joint. D. Gliding joint. The right answer is ball and socket joint. Question 67. The original of humeral rotators would most likely be on what bone? A. Scapula. B. Clavicle. C. Radius. D. Humerus. The right answer is scapula. Question 68. The type of joint found in the spine is _ A. Ball and socket. B. Condyloid. C. Saddle. D. Gliding. The right answer is gliding. Explanation: the gliding joint, also called a plane joint or arthrodial joint, is a type of joint in which the articulating surfaces of the involved bones are flat or only slightly curved. Joints are important structures in the body that connect bones and allow movement and shock absorption. The ends of the bones that connect in the joint are called articulating surfaces. The unique, flat shape of the articulating surfaces in a gliding joint let the bones slide over one another, often allowing a large range of motion. These joints are present in the spine, wrist, foot, and the clavicle. Question 69. The xiphoid process can be found _ A. On the humerus. B. On the sternum. C. Surrounding the joint. D. On the temporal bone. The right answer is on the sternum. Question 70. What is the name of the largest foramen in the body? A. Acetabulum. B. Obturator. C. Spinal. D. Magnum. The right answer is obturator. Explanation: the obturator foramen, Latin foramen obturatum, is the hole created by the ischium and pubis bones of the pelvis through which nerves and blood vessels pass.